I'm Dr. Hemmer here at the Center of Dental Professionals, and I'm going to talk about what to do when you lose a single missing tooth. How do you replace it? There's a couple of options. So there's one tooth, there's another tooth, and then we're missing a tooth here. And then I'm going to draw that again. Those are the roots. So the first option is a bridge. A bridge is when we crown the tooth next to it and we crown the other tooth next to the space, and then we have another crown made right here, and they're connected. That's a bridge. Now the downside to the bridge is it has to be replaced. I've heard all sorts of averages. They say the average is about 12, 15 years. Sometimes it's longer, sometimes it's less. It just depends on the quality of the bridge and how good you take care of your teeth, how often you're going to the dentist to have your teeth cleaned and examined. So it will not last forever, and you'll have to have it replaced. The other downside is you can get decay underneath these, and then you have to have it cut off and replaced. The decay can get into the nerve, then you need a root canal, or sometimes just by prepping a tooth for a crown, in rare cases, you can actually traumatize the tooth and it ends up needing a root canal, and then you just damaged those teeth. So there's a lot of risks involving with a bridge, and there's a much better option than a bridge, and that's a dental implant. A dental implant is when we place basically a screw into the place where the old tooth used to be. A lot of them are made out of titanium. There's some newer ones that are made out of zirconia. And then after that heals, it integrates with the bone, and that's called osseointegration. Then after the healing and integration, we put a crown on that. And there's a little piece that gets screwed into that as well. The nice thing about this is the success rate of these is about 98%, and it lasts the rest of your life. You never have to have it redone or replaced. And it doesn't affect these teeth here. We don't have to touch these teeth. So these teeth stay untouched, and this puts no risk to these teeth. Now there's some scenarios where an implant isn't the best option because of lack of bone, or the patient has some risk factors, like they have uncontrolled diabetes, uncontrolled AIDS, they're immunocompromised, or have some other health problems where an implant probably is not the best option. But those are rare. In the vast majority of cases, implants are the best option. Now, up front, they cost a little bit more than a bridge. However, in the long run, they're far less expensive because this has to be replaced, and you're damaging these teeth with the bridge, causing more expense to these potentially, and we're not touching these teeth. So in my opinion, I didn't write implant here. In my opinion, and I would guess most dentists would also agree that this is a far better option than a bridge. Again, if the scenario allows it. It's rare that it doesn't, because we can graft bone and do other things that can make this possible. So that's all I wanted to share today. Thanks.